Aviation and health officials continue strict COVID-19 monitoring at the airport. FAO supports Ethiopia to fight crop-destructive locust. Nigerian doctors strike over delay of salaries. These and more coming on The World Today. Hello, this is iAfrica TV, and of course you are watching the today's news bulletin on iAfrica TV. I am Amadou Kante, and now the news in detail. Now, Gambia's cabinet has approved a $500 million emergency fund for coronavirus response during a State House meeting presided over by President Adama Barrow on Thursday. Under the laws of the country, the President has prerogative powers to make such approval under any emergency situation. The fund will enable the Minister of Health to provide effective, adequate, and timely response to the outbreak. Since the outbreak of the infectious virus that is now classified as pandemic by the World Health Organization, one case is confirmed in the Gambia, being a traveler from the United Kingdom. On Thursday, the government issued a mandatory quarantine of anyone coming from 47 affected countries in Asia, Europe and America for a period of 14 days. This move followed the suspension flight into the country from 13 destinations on Thursday.
We had a long cabinet meeting, you realized, and quite a lot of the time was spent discussing on the situation of COVID-19 in the country. What we have been able to do, the case that has been confirmed in the Gambia, the condition of that case, which we all know is stable. The patient is stable, receiving supportive treatment, at the MRC health facility. We've been monitoring the situation, and the cabinet was informed as to the current state. We also deliberated extensively on what to do next. Been busy in cabinet, but our other teams have been working, following up, and then probably a decision is made by now. I'll be informed accordingly as to what will happen to those people who broke the law and went into the communities, risking the lives of, or risking creating more risk for the entire nation.
Gambia's Health Minister Dr. Ahmadou Samate speaking there. Now, elsewhere, Chinese health workers have shared their country's coronavirus experience with health experts from the African Center for Disease Control and Prevention with the Africa CDC. The experience sharing, which was conducted via Skype meeting, was held at the African Union headquarters in Addis Ababa, Ethiopia, where the continent's health experts listened to their Chinese colleagues who spoke about their experience in trying to cope further spread of the COVID-19. Let's have more details of that in this report.
Health experts from the Africa Centers for Disease Control and Prevention, or the Africa CDC, gathered at African Union headquarters in Addis Ababa, Ethiopia. Over a Skype meeting, they listened to their Chinese colleagues who spoke about their experiences in trying to curb the spread of COVID-19.
As of Wednesday, the 18th of March, we have 31 African countries out of the 55 member states that are reporting confirmed cases of COVID-19. And we have slightly over 500 cases in these 31 countries. So I would say that the outbreak in Africa has started, and more countries are getting affected.
The Chinese health experts shared knowledge with their African colleagues on various issues, such as how to trace close contacts at the peak of the outbreak.
From the very beginning of the outbreak, before Africa even received its first case, we were learning what was going on in China, we were exchanging information about how China is responding in China, and we were also preparing ourselves based on the experience in China. We are working with all the 55 member states to get their capacity to be able to diagnose the virus. Secondly, to enhance surveillance at their ports of entry, because we expect that the first case in a country will be imported from outside. And thirdly, to strengthen the ability of the health system to be able to manage the first cases, and therefore not let it spread within the country.
The African health experts also commended China's efforts in fighting COVID-19. The Africa CDC members say the remarkable results yielded by China are of great importance to Africa.
The experience that China has undergone is very important for us, because ours is just starting, while in China is just ending. I think today's meeting by video conference is a good example of that, where the Chinese government has placed its experience on the table for African countries to be able to see and use as an example for countries to be better prepared.
Through the Africa CDC, China has also provided multifaceted material assistance, including reagent testing kits. China has also provided emergency relief to African countries affected by the outbreak. Chinese medical teams in African countries are also actively participating in anti-epidemic operations.
China, they are sharing knowledge with Africans on the fight against the coronavirus. And of course, from that report in Ethiopia, we come back home and continue reporting on the matters of COVID-19, because Health and Gambia Civil Aviation Authority officials at the Banjul International Airport are implementing strict COVID-19 disinfection procedures on anyone who accesses the airport premises. 3 flights landed at the airport Friday morning with only the cabin crew on board, which airport officials say were relief flights that are chartered to purposely repatriate foreign nationals. Let's have more details of that in this report.
There is strict observation of health precautions at the Banjul International Airport since government stores the announcement of suspending flights into the country from 13 destinations as precautionary measures to address the spread of COVID-19. Health workers are on standby to conduct disinfection of the premises and anyone who gets access to the airport. The country has registered only 1 case of coronavirus so far on a female Gambian who arrived from the United Kingdom. 3 relief aircrafts that were chartered by some European countries to repatriate their citizens landed at the Banjul International Airport on Friday with only the crew on board. Gambia Civil Aviation Authority Communication Manager Lamin Diba told iAfrica TV at the airport that suspension does not mean that no flight should land at the airport, but he said anyone that lands at the airport during the suspension period must be quarantined for 14 days.
One of the basic functions that we do now, that is operating the airport as we speak, means we are going to put into effect whatever it is that government is saying. Like you said in your introduction, that the 2 flights you see, the inter-airline flight you're saying and the Gambia experience flights you're saying, are basically relief flights. Relief flights are flights that are sent in empty. It's only the crew in the flight, and they're coming for one purpose: to repatriate, to take people back, people that are already here. And this is why it is important for us to go back to the question. If the airport had been completely closed, we have citizens of other states who are here in the Gambia, and states have got interest in their citizens.
As of Thursday, the World Health Organization reported that there were more than 200,000 confirmed cases, accounting for over 8,000 deaths globally, with Europe accounting for over 4,000 deaths. Southeast Asia reported 23, and the Eastern Mediterranean over 1,000 deaths. Mr. Diva confirmed that all the 3 planes that landed at the airport on Friday morning were relief flights that are chartered to purposely repatriate foreign nationals.
When you are suspended, it means an aircraft from that suspended state can come in empty with the only sole purpose of repatriating your citizens, repatriating your passengers. And then when you are restricted, it means when you come into this airport, anybody you are bringing in is going to mandatory quarantine. for the next 14 days. And that's the meaning. Suspended, you can come in but empty. You only come in here to repatriate whoever you have here. But if you are restricted as a state, a passenger from the state can only come here knowing fully well that the only thing you have is you're going for mandatory quarantine. Whether you have it or not will be dictated after the 14 days of mandatory quarantine.
Gambia government issued a mandatory quarantine for anyone coming from 47 affected countries in Asia, Europe and America for a period of 14 days, just few hours after placing a ban on flights from 14 destinations on Thursday. Reporting for Africa News, I am Amadou Kante.
Health and Aviation Authority at the airport continue to be vigilant and to be on alert, as of course the coronavirus in the country. Now, with that report there, we will now take a break and come back shortly with the remaining of the story. Stay with us. We'll be right back. Welcome back. You are watching The World Today on Africa TV, and now to the rest of the stories. Now, doctors at a government hospital in Nigeria's capital Abuja have begun an indefinite strike in protest of the non-payment of their salaries for over 2 months. The doctors say they have issued 14 days ultimatum to the government, which expired on March 6th and was later extended to March 13, but yet their plights have not been taken care of. Let's have more of that in this report.
At this government hospital in Abuja, there are no doctors or patients in sight. Doctors in Abuja have gone on an indefinite strike over the non-payment of salaries for over 2 months.
We issued management 14-day ultimatum, which lapsed on the 6th of March. And that 6th of March, we had another independent general meeting where we even extended the ultimatum to 13th, based on the meeting we had with them for them to meet up the 13th, which is Friday. I told them that even after the 13th, that we will still wait over the weekend. If by midnight of Sunday or 001 hour of Monday 16th, our monies are not paid, then we're down tools. And of course, it happened, and we proceeded on the strike action.
The government made a new payroll system compulsory for all public institutions in October last year. Since then, doctors say there have been issues paying health workers on time. The Association of Resident Doctors says despite several meetings with government officials since starting the strike, no resolution has emerged.
We couldn't actually arrive at decision, and from there we proceeded to the National Assembly. We had a meeting with the House Committee on the Health Services yesterday, and the Honorable Speaker, Honorable Femi Gbajabiamila, was in attendance physically, and he made an appeal that because of the global health emergency of the coronavirus, we should rethink our decision and all those stuff. Yes, I also told them there and then that it's not me as the president calling the strike. It was a Congress decision. I will also take this message back to the Congress.
The strike comes with health workers potentially in high demand if the coronavirus outbreak spreads. And doctors say there is need for better motivation for them at such a time as this. However, it is not clear when the doctors will resume work, despite pleas by the government officials for more time to sort out the payment issues.
A prolonged strike by doctors could hinder the efforts by the country to curb the spread of the coronavirus. The hope is that the ongoing deliberations between the government and doctors can bring about an agreement soon, so lives aren't put at risk.
Some doctors there in, of course, strike at one of the hospitals in Abuja, Nigeria. And from that report, we come back home and talk something different, of course, on matters to combat the COVID-19. Youths of the Kanifing Municipal Council have facilitated the installation of hand-washing facilities on different locations within the municipality. The move is being described by Secretary General of the Gambia Red Cross Society as a service to the nation. He spoke high of the application of the preventive measures.
If you ask me the priority for Gambia, there are three. One is prevention, two is prevention, three is prevention, and nothing else. We have an opportunity, we have this window of opportunity now that we have one case. Let's all work together. Looking at the example or taking the example from Kanifing Municipality youth and the Kanifing Municipality leadership, I think we all need to come together, civil society, and prevent corona from spreading in the Gambia.
I had started with hand sanitizers selling at $60. Some are selling it for $200, and some hand sanitizers some are selling for $600. Bag of rice is increasing, but the variables haven't changed. The duty is the same, the dollar is the same. So of course these are just exploitative measures. So we caution the business community. This is a very hard time for the Gambia, a very hard time for the world. We all have to be compassionate and to ensure that we don't take advantage of each other.
Lord Mayor of KMC speaking there now. The government of the Gambia has ordered for compulsory quarantine of all travelers from any coronavirus hit destination across the world. So far, only one case is confirmed in the Gambia. And from that development, and of course, within the Kanifing municipality on the fight against the coronavirus, next we report on something different this time in Ethiopia, because the United Nations Food and Agriculture Organization (FAO) is helping Ethiopia fight swarm of locusts that are causing major destruction on crops within the provision of a spraying aircraft along with helicopters. The Global Food Agency says the swarms are tough to control and are damaging livelihood of the population in high intensity. Let's have more of that in this report.
This is one of the spraying aircrafts that the UN Food and Agriculture Organization has leased to assist Ethiopia in aerial spraying of locusts along with helicopters. The organization says that the swarms are tough to control and are doing major damage to crops.
It is difficult because it's affecting livelihood of the people. The intensity is very high, the spread is very large. So this is something that Ethiopia has not seen over the past 25 years. Kenya have not seen it over the past 70 years. Yet we are prepared. As you have seen also, we have the experts from FAO. FAO is sending experts to the country. The countries have their own experts, and we must seriously upscale all the operation to minimize the losses and to control this crisis. It can be done, but we need the resources to do it.
The aircraft can fly over 4 hours, carrying 1,500 liters of insecticide with ability to cover 1,500 hectares. Ethiopia, whose southern region is now a breeding ground for locusts, says it needs at least 8 aircrafts to get the situation under control.
In the east, it was not with the same degree that it was before. I mean, it used to come and go. I mean, it was not a big deal to control it in the beginning. But this time, it was not only in the east. It was moving. Maybe this could be associated with the direction of the wind, maybe associated with climate change. You can name it so many things. But it is not very familiar, like you said, to see it in the west or even in the central part of the country. Even if it happens previously, it just come and go. It disappears. It has never lasted. It's going to for a year now since it came to Ethiopia. So now we are still expecting somewhere by the by the time we are talking here, maybe it is hatching somewhere else. So we are expecting some in some places again to appear.
In addition to aerial and ground spraying using technical people, the country is now training local communities on how to combat the insects.
This needs a coordinated action from the local people, and we need to also train people even not to combat, to identify the breeding place, so that if we attack in the breeding place, that is the simplest way of attacking locusts actually.
The Food and Agriculture Organization says the swarms are now under control in Sudan, Eritrea, Egypt, Saudi Arabia and Oman. The organization has made an emergency appeal for over $130 million to assist the 9 countries affected by the invasion. So far, it has got over $50 million. It hopes more donors will respond quickly to save crop production in the affected countries.
The impact of locusts is hitting high in Ethiopia, and of course with that report we will bring this news bulletin to an end. But for more on these stories and others, you can also log on our website on iafrica.tv. Once again, I am Amadou Kante, and many thanks for the pleasure of your company, and bye for now.